The next section is entitled Temperature Regulation. Humans maintain a normal body temperature at a set point of 37 degrees Celsius. And because environmental temperatures vary greatly, the body has mechanisms coordinated in the anterior hypothalamus for both heat generation and heat loss to keep the body temperature constant. When the environmental temperature decreases, the body generates and conserves heat. When the environmental temperature increases, the body reduces heat production and dissipates heat. When environmental temperature is less than the body temperature, mechanisms are activated that increase heat production and reduce heat loss. These mechanisms include stimulation of thyroid hormone production, activation of the sympathetic nervous system, and shivering. Behavioral components also may contribute by reducing the exposure of skin to the cold, for example, wrapping arms around oneself, curling up in a ball, or adding more clothing. First, we'll discuss thyroid hormones. These hormones are thermogenic. Their actions on target tissues result in heat production. The major actions of thyroid hormone are stimulation of sodium-potassium ATPase, increased oxygen consumption, increased metabolic rate, and increased heat production. Therefore, it is logical that exposure to cold temperatures activates thyroid hormones. The mechanism for this activation is not entirely clear, but it includes increased conversion of thyroxine, or T4, to the active form triiodothyronine, or T3, in target tissues. Because thyroid hormones are thermogenic, it follows that an excess or deficit of thyroid hormones would cause disturbances in the regulation of body temperature. In hyperthyroidism, for example in Graves' disease or thyroid tumor, the metabolic rate increases, oxygen consumption increases, and heat production increases. In hypothyroidism, for example in thyroiditis or surgical removal of the thyroid as well as iodine deficiency, there is a decreased metabolic rate, decreased oxygen consumption, and decreased heat production, as well as extreme sensitivity to cold. In Chapter 9, we'll discuss this topic more thoroughly. Next, the sympathetic nervous system is another way of generating heat. A second consequence of activation of the sympathetic nervous system is its stimulation of alpha-1 receptors in vascular smooth muscle of skin. This produces vasoconstriction. Vasoconstriction also reduces blood flow to the surface of the skin and consequently reduces heat loss. Shivering, which involves rhythmic contraction of skeletal muscle, is the most potent mechanism for increasing heat production in the body. Cold environmental temperatures activate centers in the posterior hypothalamus, which then activate the alpha and gamma motor neurons innervating skeletal muscle. The skeletal muscle contracts rhythmically, generating heat and raising the body temperature. When the environmental temperature increases, mechanisms are activated that result in increased heat loss from the body by radiation and convection. Since heat is a normal byproduct of metabolism, the body must dissipate this heat just to maintain body temperature at the set point. When the environmental temperature is increased, more heat than usual must be dissipated. Mechanisms for dissipating heat are coordinated in the anterior hypothalamus, and increased body temperature decreases sympathetic activity in skin blood vessels. This decrease in sympathetic tone results in increased blood flow through skin arterioles and greater arteriovenous shunting of blood to venous plexuses near the surface of the skin. In effect, warm blood from the body core is shunted to the body surface, and heat is then lost by radiation and convection. Shunting of blood to the surface is evidenced by redness and warmth of the skin. There also is increased activity of the sympathetic cholinergic fibers innervating thermoregulatory sweat glands to produce increased sweating or cooling. The behavioral components to dissipate heat, including increasing the exposure of skin to the air, for example, removing clothing, and fanning. The temperature regulating center is located in the anterior hypothalamus, and this center receives information about environmental temperature from thermoreceptors in the skin and about core temperature from thermoreceptors in the anterior hypothalamus itself. The anterior hypothalamus then orchestrates the appropriate responses, which may involve heat-generating or heat-dissipating mechanisms. If the core temperature is below the set point temperature, then heat-generating and heat-retaining mechanisms are activated. As previously discussed, these mechanisms include increased metabolic rate, that is, through increased thyroid hormone production and an increased sympathetic nervous system activation, as well as shivering, as well as vasoconstriction of blood vessels to the skin through increased sympathetic tone. If the core temperature is above the set point temperature, then heat dissipating mechanisms are activated. And these mechanisms include vasodilation of blood vessels of the skin, that is, decreased sympathetic tone, and increased activity of the sympathetic cholinergic fibers to the sweat glands. Next, we'll discuss fever. Fever is an abnormal elevation of body temperature. Pyrogens are cell-cell communication molecules that produce fever by increasing the hypothalamic set point temperature. The result of such a change in set point is that a normal core temperature is seen by the hypothalamic center as too low relative to the new set point. The anterior hypothalamus then activates heat-generating mechanisms, for example shivering, to raise the body temperature to the new set point. At the cellular level, the mechanism of pyrogen action is increased production of interleukin-1 in phagocytic cells, or IL-1. IL-1 then acts on the anterior hypothalamus to increase local production of prostaglandins, which increase the set point temperature. Fever can be reduced by aspirin, which inhibits the cyclooxygenase enzyme necessary for the synthesis of prostaglandins. By inhibiting the production of prostaglandins, aspirin and other COX or cyclooxygenase inhibitors interrupts the pathway that pyrogens utilize to raise the set point temperature. When fever is treated with aspirin, the body temperature sensors in the anterior hypothalamus now see the body temperature as too high relative to the set point temperature and set in motion the mechanisms for dissipating heat, including vasodilation and sweating. Heat exhaustion can occur as a consequence of the body's responses to elevated environmental temperature. Normally, the response to increased temperature includes vasodilation and sweating in order to dissipate heat. However, if the sweating is excessive, it can result in decreased extracellular fluid volume, decreased arterial pressure, and fainting. Heat stroke occurs when the body temperature increases to the point of tissue damage. If the normal response to elevated environmental temperature is impaired, for example if sweating does not occur, then heat cannot be appropriately dissipated, and core temperature increases to dangerous levels. Malignant hyperthermia is characterized by a massive increase in metabolic rate, increased oxygen consumption, and increased heat production in skeletal muscle. The heat dissipating mechanisms are unable to keep pace with the excessive heat production, and if the hyperthermia is not treated, the body temperature may increase to dangerously high or even fatal levels. In susceptible individuals, malignant hyperthermia can be caused by inhalation anesthetics. Inhalation anesthetics, in combination with neuromuscular blocking agents, classically cause malignant hyperthermia. This concludes our section on temperature regulation.